we are going to start this 14th national webinar of All India Association of Medical Social Work Profession. And for the topic of the webinar is Society After COVID-19 Pandemic, where will we stand? This is a very important concept and topic we are going to discuss, because as you all know that COVID-19 pandemic has ripple the our all's life in all the domains of the life. When we can tell about our physical life, our emotional life, our mental life, as well as our some financial life. So there is a too much drawbacks we have found in this Corona 19 COVID-19 pandemic duration. So for this we have decided what are the this where we will stand after this COVID-19 pandemic. For understanding about this, we had planned this topic. For this, we have a chief guest, Professor Mohan Mukherjee sir, who is the former head and professor of Department of Social Work, Vishwa Bharati Shanti Niketan, Birbhum. And for the today session, we have Miss Atri Chatterjee. She is the guest lecturer in Department of Social Work, Ravindra Bharati University, Kolkata. Uh, for the keynote speaking, I would like to invite Manju Mohan Mukherjee sir. Manju Mohan Mukherjee sir has done his MA Social Work and PhD from Kashi Vidyapeeth, and he is the former head of Department of Social Work in Vishwa Bharati Shanti Niketan, Birbhumi. Sir has also held many administrative positions such as Program Coordinator of NSS Vishwa Bharati, Coordinator Council of International Program Cleveland, Ohio, USA. Sir has also held the former president post of Indian Society of Professional Social Work, and sir has attended n numbers of conferences and seminars and presented various papers in international and national level. Uh, and sir has, as well as sir has published many papers in international and national level, as well as published many book chapters in very ISBN number books. Sir has also received various awards and scholarships at national and international level, such as sir is the Fellow Council of International Program of Cleveland, Ohio, USA. Sir is also a Fellow of Council of International Fellowship from Vienna, Australia, and Budapest, Hungary. Sir is also a fellow of the Indian Social Science Association, Agra, and also a fellow of Indian Association of Social Psychiatry, Chandigarh. Sir is also a visiting fellow of Central Institute of Psychiatry, Ranchi, Jharkhand. So with this, I would like to invite sir as a chief guest to give the keynote speaking on this prominent issue. With this, I would like to invite Dr. Manju Mohan Mukherjee, sir. Sir.
Okay. Are you hearing me? Hello?
Yes, sir. You are audible, sir. Yes, sir. You are audible, sir.
Okay. Dear students, colleagues, and friends, I am indeed grateful to all the members and office bearer of All India Association of Medical Social Work Professionals for inviting me this afternoon to speak on Society After COVID-19 Pandemic, where we stand. I am thankful to members of East Zone, especially the Secretary, Dr. Narendra Kumar Singh. I extend my gratitude to my young colleague, President of the Association, Sri B.R. Sekhar, All India Institute of Medical Sciences, New Delhi. I am equally thankful to North Zone Secretary, Dr. Prashant Srivastav, who is moderating the webinar. I will extend my thanks to Srimati Atri Chatterjee, teachers in Ravindra Bharati University, Kolkata. She will speak on the subject in detail. I will extend my special gratitude to Dr. Om Prakash Giri, Postgraduate Institute of Medical Sciences, Chandigarh, who is working hard for the association, and he wished to develop the association at the international standard. Friends, today I have divided my discussion in two parts: identifying the emerging issues, and second, assessment of their implication in future. The Prime Minister Sri Narendra Modi on 24th March 2020 announces India will follow lockdown. Since then, 6 months, we all are under the COVID-19 pandemic. The pandemic has already reshaped our economy beyond imagination. There are at least 10 crores or 100 million people above the poverty line. All of them will fall below it. The effect of coronavirus are increasing every day. In this coronavirus era, India has confirmed cases of 45 lakhs 62,414 and overnight addition in 96,551. Friends, some people are making mistakes. These mistakes will cause a lot of damage to the individual as well as their family. Many people are not wearing masks in the busy places, and they do not follow social distancing or physical distancing while they are visiting the market or other public places. Most people are talking to each other for a long time without following the protocol for COVID-19. Friends, in today's Telegraph newspaper, a front page news appeared about a 45 years COVID positive patient. On Tuesday, the person was tested positive. He stayed at a very small house with his elderly parents. There was no possibility for home isolation. He wanted to go to hospital but did not know the procedure. The person was very lucky that Sri Sujit Bose, the Minister of West Bengal government, came to know about the person, and the patient was transferred to safe house. There are a lot of misconceptions regarding the charges of hospitalization, charges of medicine, charges of ambulance, etc. It is therefore necessary that a detailed information regarding the names and address of COVID-19 hospitals with contact numbers, charges of treatment, charges of ambulance, etc. should be announced and distributed through leaflet in all the panchayat and offices of government and non-government organization. The COVID-19 outbreak affect all segments of the society, whether people are affluent or living in poverty, youth, elderly, etc. The solidarity and collective responsibility are needed now much more than ever to defeat the virus. Friends, the refugees, migrant, displaced people, the disabled, mentally ill, orphans, people in prison, homeless, those addicted to various substances. This segment of people need special attention to address their requirement. Many of these vulnerable people cannot easily follow the protection measure such as hand hygiene or stay at safe places. For example, homeless people. Their health need must be met together with the specific testing and treatment, along with food and safe shelter. There is a need for COVID-19 fundraising activities. Most of the recovered patients are honored by providing the bouquets and flowers by the health worker at the hospital. Those patients who are recovered may be requested to donate money for the COVID-19 pandemic, and the government should provide interim financial support to the vulnerable groups. Today, millions of children and youth are out of schools and universities. The quality education is missing completely. Majority of youth are facing the problem of unemployment. Many young people have lost their jobs. Those who are employed are now working from home with cut in their wages and salaries. Friends, but COVID-19 pandemic has opened some new opportunities as well. During during unlockdown 4, the railway will run trains on routes where the loads of passengers are very high. These trains will halt at limited stations. The speed of this train will be higher than the existing special mail and express train. From today, 80 pairs of trains will be in operation in the country. The operation of metro rail is also adding the situation towards normalcy. Efforts are initiated to conduct the university examinations online or offline. There are possibility to opening of schools for 9 to 12 classes in phased manner. The students should follow the COVID-19 protocol while attending the school. Prevention is better than cure. I request all the people, the fellow social workers and the students to spread the message to improve the immunity with the help of balanced and nutritious diet. Do regular exercise to keep yourself fit. Control the blood sugar and blood pressure. Stay healthy and stay safe. This pandemic and its impact on our lives is exceptional. But every hour we are sharing our knowledge to take steps to stop the COVID-19 and make our health more sustainable. I wish to hear from discharged patient saying that I have survived COVID-19. That is a motivation for me to keep going. I will do everything that is humanly possible to overcome the situation. The only thing I will ask you to stay at home. The COVID health worker will work for you. Lastly, I am quoting from Pope Francis. Rivers do not drink their own water. Trees do not eat their own fruits. Sun does not shine on itself, and the flowers do not spread their fragrance for themselves. Living for others is a rule of nature, no matter how difficult it is. Life is good when you are happy, but much better when others are happy because of you. Thank you very much, so much for listening to me. Thank you.
Thank you so much, sir, for giving encouragement words and motivating us with such a nice phrase. And you have nicely covered the role of what is the pandemic, what are the situations if you in the COVID-19 pandemic condition, and how to cope with this situation, what to do in this scenario. That will be definitely helpful for all of us, and definitely we will follow your words. And I request to all the participants to kindly please follow the whatever the sir has suggested. That will be helpful for all of us. So with this, thank you so much, sir, for joining us and giving us a very nice brief about the topic. Thank you so much, sir. For the today's webinar, I would like to invite Miss Atri Chatterjee, and Miss Atri Chatterjee is a guest faculty in Rabindra Bharati University, Kolkata, and she has holds master degree in social work from Rabindra Bharati University, Kolkata, and she has completed his MPhil in psychiatric social work from Institute of Psychiatry, Center for Excellence, Kolkata. Currently, she is working as a guest lecturer of social work in Rabindra Bharati University. She is also voluntarily engaged in with telephonic counseling session that will be really grateful for the society. And her area of interest is a mental health services, children in need of care and protection, and family therapy, as well as many various areas she has practiced, as well as she has published many papers and given many presentation in national conferences. So with this, I would like to invite Ms. Atri Chatterjee for giving his presentation and guiding us. So Ms. Atri Chatterjee, over to you.
Thank you. Am I audible?
Yes,
Am I
you are
audible?
ma'am.
Oh,
Yeah, you are
thank
audible. You are visible and audible.
Thank you, Prashant sir. Thank you for this wonderful introduction. Firstly, good afternoon to all the panelists, all the members, and I would like to thank the All India Social Work Professionals for inviting me this evening. And this the topic is wonderful, and I would like to thank Dr. Manju Mohan Mukherjee sir for his extraordinary speech. Thank you, sir. It's very much needed nowadays, the words you have spoken. Thank you very much. Now I'll directly go to my slides. So would you present it, or I'll present my slides?
Yeah. I will share. I will share it. Yeah, I will share it.
Okay, thank you.
It's visible?
No.
Yes.
Yeah.
It's visible to all? Yeah.
Next slide, please. Okay. So
I have
nowadays,
moved. Yeah.
okay, thank you. Nowadays, we are very much aware about COVID-19. We know its symptoms. We know the after effects. These are the things in medias nowadays coming up regularly, in regular basis. And we know about pandemic. We know COVID-19 pandemic. So if I'll talk about COVID-19 pandemic, that will become very boring because already many of us already have attended lots of webinars and talks regarding COVID-19 pandemic. So I'll directly jump to slide 4, I think. Where should I start? So please, slide number 4.
Yeah.
Next, please. Next.
That is. Yeah. What is pandemic?
No, the next slide with a picture. The slide with a picture. 5th slide. Slide number 5. Slide number 5. Just the next slide. Yes. So, society after COVID-19 pandemic, where will we stand? This is my today's topic. So, where will we stand? This is a story about future. There must be some assumptions. Okay, so we are the social workers. We always try to understand any situation very thoroughly and deeply. And by that understanding and assessment, we can say that some changes will occur, something new will happen. So after a detailed assessment of this pandemic situation, we can also say that our society will face a huge change after this pandemic will over. And we all know that every change has two sides, positives and negatives. We can say that nowadays we are spending more time with our family members. I must say that our generation specifically are very social through social medias. But genuinely, we spend less time with families because we have lots of attachments outside. But due to this COVID-19 situation, this lockdown situation, we started spending time with our parents, our spouses, our children, our siblings. In fact, some of us really find out our old Ludo boards or chess board and started playing with our brothers or sisters or mothers. In fact, some of us started nurturing our soft skills like singing, dancing. We are uploading those videos in the social medias. We are motivating ourselves. Those are the self-motivating things. And obviously, these are positive signs. But at the same time, the back of our mind, there is sorrow. We are in a fear that what will happen tomorrow? What will be there? What's our future? What's the future of our generation or the next generation? These are the negatives. And not only us, the other strata of the society, the other sectors, our domestic helpers, the daily wage earners, they are unwell. They are unable to on their vacation mode. They're not cherishing their meals happily because they are continuously in trouble. So today, I'll try to talk on some features, some domains which are greatly affected by this COVID-19 pandemic. So, impact on economy. Economy of India, not only India, but the world economy is largely affected by this COVID-19 pandemic. We can see that rising number of unemployment. There are lots and lots of unemployments. The corporate sectors, they have fired some of their employees because sometimes the administrators trying to squeeze their business. In fact, not only unemployment, I can say that many of us who are working, but we are not getting our salaries properly on time. In fact, the persons who are engaged with advertisement sector, they suffered from this problem largely in the initial stage of pandemic. Some friends of mine are attached with advertisement sector, and I have heard it from them that they are not getting their salaries, they are getting 50% of their salaries. So these are the problems they are suffering. There was a study by Monitoring Indian Economy, Center for Monitoring Indian Economy, largely known as CMEI. The report showed that in urban area, in the month of June, the unemployment rate has increased by 11.2%. And in the same period of time, in rural areas, the unemployment rate has increased by 7.26%. This is very threatening, actually. But one thing, that is, from the same study, I've learned that in rural area, the unemployment rate is little less than urban areas. Yes, because there is a sudden increase in the Mahatma Gandhi National Rural Employment Guarantee Scheme. So some people are getting attached with that scheme, and they're doing something for, they're earning something. And also, this is the time of Kharif. So there is an increase in Kharif sowing. So some people are getting some monies for doing their this types of works, this kind of works. Next, please. Okay. And there is a huge previous, please. Previous, please. Okay. And there is a decrease in government income. Look, if the government income decreases, then obviously there is a decrease in government involvement. Government is not getting their proper taxes, not getting their monies. Industries, we have learned from social medias, from researches, that industries like tourism, hospitality industries are collapsing. So they're unable to pay their taxes. So obviously government income decreases by this also. And most importantly, the news which is coming every day in the newspapers, that is the GDP contraction. In this quarter, April to June financial year 2021, the GDP contracted by minus 23.9%. 23.9%. It's an alarming situation. And in fact, most probably on 7th of September, there was a tweet by Raghuram Rajan, the former RBI governor. Sir said that Indian economy is diseased. The government has to treat it like a diseased person, actually. And Mr. Rajan also added that if this situation continues, then many of the population will skip their meals. In fact, they will pull out their children from schools and send them for beggary or for as child laborers and something like that. So he proposed that government should announce some packages. That packages which is already announced by government is not enough. Is not enough. We all know that, and Mr. Rajan also said that that is not enough. Government has to announce some more packages. Otherwise, the situation will become worse and worse. Next, please. Okay. A very important part, education. A very important domain, education. So, impact on education. Education sector is largely affected by this COVID-19 pandemic situation. Small children are facing problem in online learning because now we are very much dependent on online learnings, e-learning modes. These are good. These are new, relatively new. These are good. Obviously, this mode of learning is good. But small children, I'd like to share my own experience that small children of my relatives, they're saying that they are not liking it because they want to play. They want to touch their friends. They want to touch their teachers. They're unable to do that. In fact, they got distracted. sometimes they don't want to spend more time in front of the devices. They're not liking it. In fact, a few days before, I was in a webinar where a principal from a very reputed school of Kolkata said that she was doing a virtual walk through classes, and when she went to the class 2, standard 2, one little girl raised her hand for touching her teacher, but she was unable, and she started crying miserably, because she was so attached with the teacher. She started crying. So that is obviously a big problem for the children and for the parents. Are they all right? Today's adults are very tech savvy, so are they all right with this online mode of learning? I am attached with an university, so most of my students are adults. So here also I can explain some of my personal experiences. Firstly, the problem is connectivity problem. Whenever we are trying to arrange any e-classes or any examination through internet, through this social media, social platform, university, many students come from the northeast areas, come from Assam, some from coastal regions of West Bengal. They are unable to join. In fact, in examination situations, they are also very worried that how could we be able to give the examination, ma'am or sir, because there is huge connectivity problem. And this also can happen with the teachers also, not only students. Teachers can also be the sufferers of the same problem. And one more thing, which I must have to say here, because I am a student of social work, I am a teacher of social work, and all are here are persons of the same field, social work. So field work, this is a very important part of our study. We all have done our field works during our MSW courses or MA in social work courses, and also our PSW and other respective all courses. Field is very important. But in this current situation, many of the final year students are unable to complete their fields. They are unable to do their internships. And as because I am attached with social work, I can say that easily. But also there are many practical subjects which have, there is a lacking in the practical classes. The students are also unable to complete their practicals. And not in case of practicals, not only the final year students, but who are say studying in class 11, if they do not fulfill their class 11 chemistry practical, how will they do their class 12 practicals? So these are the problems. These are the emerging problems. And when these students will go for any job, the final year students of MSW, they'll pass out in a few months, and most probably in this month actually, and they will pass out and they will go for jobs, but they will face the problem. They will understand the gap in their learning, that there is a gap. They do not attain their field works due to these situations. So there might have to be some time period for their internships, for their trainings and all that. This should be the this should be the measures will taken by the organizations. I don't know what will they do, but this can be done. And obviously, there are some students who are planning for higher education in this country or in abroad. Their plannings are also all gone in vain. They do not know what will happen in future. Are they be able to go for this other institutions, or what will happen? They don't know. We also don't know that what will happen. So obviously we have to think of it. We have to think those measures which we can implement after the situation will over. Next, please. A very important thing, health. So nowadays, the general health problem those who are suffering from general health issues are trying to not go to the clinics, the hospitals, because obviously there is a fear that if I go to the clinic and there are some corona patients, COVID-19 patients, I might be infected by him or her or by them. So sometimes we are just staying at home, not going to the doctors because of our because for the treatment of our general health problems. So this, in fact, the terminal illnesses are not getting proper treatment. We can heard this from various sources. And from a survey of World Health Organization, the results showed that since the COVID-19 pandemic began, prevention and treatment services for non-communicable diseases have been severely disrupted. This is for the non-communicable diseases. And this survey was done in the initial phase of lockdown. And we are on September. We don't know what is happening nowadays. And we all know that there are a huge lacking of physical activities. Small children, they are not going to play. They're sitting in front of the screens many a times, sometimes the whole day, and they are putting on calories. So obesity rate will be increased. It's already increasing and it will be increased. And not only children, we the adults who are working from home, we are sitting all the time in these chairs and tables. I'm always sitting, and I don't know how much my calorie level increased. So there must be some problems, like our veins will suffer for this, and obesity is cause of many diseases. We all know that. So to get proper attention for general health problems in this situation has become very difficult, and we should have a cascading effect in future. I must say it's a cascading effect. We don't know what's happening there. I think when the situation will when this pandemic situation will over, there must be many of complaints regarding the general health issues, many more complaints than before. Next, please. Next, please. Okay. So here I would like to add on something. On yesterday's newspaper, 11th September, the Times of India, a report from the Times of India showed that more than 1 million children have missed crucial immunizations, and hospital births have shown a sharp decline, indicating many women have gone through unsafe childbirth at home. Outpatient critical care for cancer plunged 80% from February levels. The latest government data show that. So this is also, again, a very alarming situation. And on the same report, I found out that Dr. Zarir Udwadia, a famous pulmonologist of PD Hinduja Hospital and Medical Research Center of Maharashtra, Mumbai, he conducted a study, and Dr. Udwadia's study results showed that the country has as many as 2.7 million tuberculosis patients, currently by far the most in the world. And the disease kills an estimated 421,000 Indians each year. The current gap in care could lead to an additional 6.3 million cases and 1.4 million deaths from tuberculosis by 2025. Tuberculosis is it was a big threat for us. We know that. My parents, in fact, sometimes they told me that before the BCG vaccine, there was a great threat of tuberculosis. But with time, we have made up the problem somewhat. But we don't know what will happen again. And Dr. Udwadia added that miss a few days of any other treatment and you may not be harmed, but gaps in TB treatment will amplify resistance. Again, in health sector, we also in a very much alarming condition. I must say that. Next one, please, sir. Impact on mental health. Mental health, a very, very, very important domain, a domain very close to my heart, a domain which is very close to all of us. We are here. Many of us are PSWs, and the social workers also deals with mental health problems many a times, almost regularly. So you must be thinking that what is happening here. The speaker has wrote down some name of some mental health disorders in the slide. We all know from our general knowledge that yes, obviously these types of disorders are increased or increasing. Yes, and if you search on Google, there are n number of scholarly articles that these types of like depression, panic, anxieties are increasing or increased day by day due to this situation. But now I'll go to explain something which is not in the slide. I think something is more important than this. Yes, something is more important. You must be thinking what she's talking about. The treatment gaps, the gaps in checkups. We all know that mental health issues need regular checkups, follow-ups, regular medications, and regular therapy sessions. But in this present situation, there is a huge gap, there is a lacking in these regular checkups, regular therapy sessions. I'm from West Bengal and I've done my MPhil PSW from a government hospital. So I've seen that the persons who are from urban areas can afford treatment in private institutions. But those who are from rural areas mainly dependent upon the government hospitals. But the problem of conveyances, nowadays all the trains are stopped, the bus services are not available. So maximum clients are unable to come to the hospitals. In fact, some patients calls us and tells that, Madam, how could we go to hospital? We know that our medicines are stopped, but what could we do? Because there is no trains. The buses are not available from where I stay. So this is a big problem. And I've talked some fellow friends also. They have also said that, yes, there is a problem. The clients are not coming regularly because obviously there are problems. All of them are not able to book a bus or a Ola cab or Uber and go to the hospital. So this is a big problem. And this is a problem of present day. So what's it linked with future? Because my topic is society after COVID-19 pandemic. So I think in case of mental health, two things can happen. Either when the situation will get normalized, many patients come to the hospitals, there will be a flood of patients and it will be, and managing which will be a problematic work for the professionals. I can imagine the OPD of IOP actually, what will happen there if the flood will come, or many clients stop their medications, stop their treatment. They will not come for their treatments. Actually, all of us, the social workers, have noticed that many persons said, educated, uneducated, living in urban areas, living in rural areas, they said that taking care of mental health is a luxury. I think after this situation, after this COVID-19 situation, many a person will add on to the list who thinks that taking care of mental health is luxury. And This is very, very frightening. Then we must have to go to door, and we plead to them for coming to hospitals and to take their treatments, for taking their treatments. So in case of mental health, I think this type of problems can occur. Next, please. Here comes the role of social workers. I have talked about few domains, but here I'll talk about the role of social workers, the role of us, what I think we can do. We all are living in a very anxiety-provoking situations, and from many studies, we have learned that yes, there is increase in depression, there is increase in anxiety, in panic. So I think there will be an increased need for us also. The society needs us, the social workers, or the psychiatric social workers, MSWs and PSWs. First of all, I think there will be an increase in telehealth services, because when this pandemic situation will over, the new normal lifestyle may not be like what we had before the situation. So many a client will be unable to go to the hospitals physically. So if there we can use our telehealth service or our satellite clinic concept, that will become very helpful for those who are living in rural areas or suburban areas. And not only for mental health issues, I think this telehealth services will also used for general health issues also, because they have also faced the same problems. So the telehealth services or the satellite clinic ideas which we have in psychiatric social work or in social work concept, that will become very helpful after this COVID-19 pandemic situation will over. And one more thing is our advocacy skill. We must be thinking that how this telehealth services or satellite services will happen everywhere, because there is internet issues. Is one cell phone is enough for the services, or how should we arrange the camps, or is there be a wide acceptance of telehealth services, mainly for we the mental health professionals are aware about telehealth services, but the general health professionals, what will be the usefulness? How could we how could we go to them and we understand? They will understand. So I think then we have to use our advocacy skill. We have to talk to the government, the local authorities, the doctors, the panchayats, and we'll arrange those so we can take a very important part in helping the persons, helping the population
Yes, sir. You are
in
audible.
reconstructions of new normal lifestyle, because new normal is not accepted by all. So we have to help them. Many a population are under poverty lines, below poverty lines. Many are not educated in our country, so they must be unaware. What sir was saying previously, that they are not using the masks, they are not sanitizing properly. So we have to use our skills to make them understand the need for the situation, the need of the society, and whenever after this COVID-19 pandemic situation, from the government, there will be some restrictions, there will be some rules. Might be the population will not understand this, and then we have to use our skills. We have to do the field level interventions. We have to do more field works. We have to go to we have to do door-to-door surveys, which we done in our MSW classes, MSW courses that will become very prominent. We have to do all these things. Those bookish. This is the time to use those bookish knowledge in practical field. I think that, and ensuring support for the vulnerable and marginalized section will become a great role for us. The marginalized section, the vulnerable section, the children, the women. I am attached with an NGO who are working with children in need. So I can share one of my experience. Just last week I have heard that many children are suffering from CSA during this lockdown period, and they are suffering from incest. And in future, when they come to their comfortable position in front of their school counselors or their teachers whom they can trust, they might be spoken up, and then we will have to work for them. And most importantly, women. The rate of domestic violence is increasing day by day. From newspapers, from medias, from television channels, we heard that. A report from The Hindu said that in the first four phase of lockdown, there were lodged cases of domestic violence is 10 times more than the same period before. And a study from NALSA showed that from the starting of lockdown till 15th of May, in Uttarakhand, there were 144 domestic violence cases reported. And in Haryana, it was 79. And in Delhi, the capital of India, it's 69. This is the report till 15th of May. And today is 12th of September. We don't know. These figures are the tip of the iceberg. We don't know what's happening. What are the exact numbers? So there must be more and more complaints. When we'll go for our OPDs, we'll get more complaints, and we have to go to the police faris again and again. We don't know. There may be many POCSO cases, and then we have to work. Then again we have to use our skills as social workers or as psychiatric social workers. And most importantly, there are government services, and I think after this situation, government may announce some packages or some services for the person in need. But many a time, many population are out of reach of those services. Then again, our field work
Vikas, Praful is there?
We will.
Yes,
We
ma'am.
are the persons there. We are tirelessly working for them, and
Yes,
we
ma'am.
will do
Yes, ma'am.
because
Yes,
we
ma'am.
are social workers. Our satellites are always on,
Actually, I
so
wanted
we
to
have to do
tell
for them.
that
We have to
I'll be joining.
provide
There is
them
a
the
meeting at 6,
information.
another important